Hello everyone, thanks so much for joining this webinar. My name is Tessa Griffiths and I'm the Director of COVID Response Measures in the Department for Education. So the topic of this webinar is Next Steps for Living with COVID from the 1st of April 2022 and what this means for education, childcare and children's social care settings. So for the next 20 minutes or so, we are going to cover an overview of the changes announced on Tuesday the 29th of March that come into effect from the 1st of April, what it means to live with the virus in line with other respiratory infections and the implications for schools and other education settings. We're going to finish the meeting by answering some frequently asked questions that we have been gathering from stakeholders. So first of all, I'd like to introduce you to Catherine Faulkner. She is Deputy Director for Children, Young People and Universities at the UK Health Security Agency, and she's going to give us a bit of an update on the current public health picture and what it means for us to manage COVID-19 in line with other respiratory infections.
Thanks, Tessa. And I want to take the opportunity to say a big thank you to everybody. You've adapted to the changing guidance really well, and we've constantly been blown away by the commitment of staff across the board to ensuring our children and young people continue to have access to opportunities to learn, socialise and develop. Today, I'm going to tell you a little bit about the guidance for education and childcare settings that comes into practice on the 1st of April. But I'm going to first start by explaining the future approach to managing COVID-19 and some of the public health rationale for this. First of all, so the UK government approach to COVID-19 is about managing in a similar way to how we manage other respiratory infections. We know that children and young people are at low risk of harm from COVID-19 infection, but are at high risk from the wider harms associated with missed or disrupted education. And so learning to live safely with COVID-19 will enable children and young people to return to a more normal way of life and enjoy the wider freedoms that support their social development, health and well-being. We know that the virus has not gone away, and we can see that clearly from the current high levels of prevalence in the community. But we also know now that most people with COVID-19 and other respiratory infections will only experience mild illness, especially if they are vaccinated. So as we enter this new phase of the pandemic, the government's focus is on protecting those that are the most vulnerable. And protection for these groups will come through the collective protective wall of vaccination, testing and treatment programmes. As part of the government's Living with COVID strategy from the 1st of April, there will no longer be a need for most people to take a COVID-19 test, whether they have symptoms of COVID-19 or not. And this aligns COVID-19 with our approach to other respiratory infections where we don't routinely test large amounts of the population. Testing will be prioritised for those who are in need of treatment, such as care home residents or hospital patients. We will do some testing to feed into our surveillance programmes to enable us to continue monitoring and tracking the virus, as well as providing valuable insights on any variants. Living with COVID means that as of April the 1st, the public health guidance will provide advice for individuals who are experiencing the symptoms of respiratory infections, including COVID-19, and will explain what people should do to minimise the risk of passing the infection on to others. This guidance will also cover what people should do if they have received a positive test result, although it is not recommended that children or young people take a COVID-19 test unless they are directed to by a health professional. In protecting those who are more vulnerable, there are really important steps that we can all take. Updated guidance for the general public will set these out so that we can all play our part in helping us to reduce their risk from a range of respiratory infections, including COVID. This will be advising people to get their full course of vaccination, observing regular hand washing, ensuring indoor spaces are well ventilated, and considering wearing a face covering in crowded or enclosed public spaces that are outside of education settings, such as on public transport. So now I've set out the wider government approach to living with COVID and the guidance for the general public that will support it, I'm going to talk a little bit about what this means in practice for education and healthcare settings. And alongside this guidance, we at UKSHA have updated our health protection guidance for education and childcare settings. Schools and other settings have been managing COVID-19 for the past 2 years and other respiratory infections for many, many more. And our updated guidance includes valuable learning, particularly from the last 2 years. For example, the role of good ventilation and hand washing. Schools, colleges, universities themselves are very well placed, able and equipped to manage COVID-19 as with other respiratory infections, and the updated guidance from the Health Security Agency provides the support for them to do so. This guidance will cover all education and childcare settings, providing advice on infection prevention and control and on managing specific infections, as well as other preventive measures such as immunisation. It also sets out guidance on when to seek specialist advice from your local health protection team. It's got a much broader focus than just COVID and incorporates wider public health risks to children and young people on which we must also maintain a focus. The content of this guidance will be familiar to you. Its focus will be on reinforcement of baseline measures, such as ensuring staff and students don't attend the setting whilst they are unwell, ensuring there's good ventilation, good hygiene practices, and principles and actions that will work for all infectious diseases, not just COVID. For example, at the moment, we're seeing an increase in the number of diarrhea and vomiting bugs affecting settings, and the same principles of exclusion and hygiene apply to this as to many other illnesses, including COVID. We'll also provide many resources which will help you to apply the guidance in practice, some of which you may already be familiar with. For example, our eBug resources, which is an online suite of resources to help students learn about infection control, antibiotics and vaccination. One of the key areas that is really vital in terms of education and childcare settings supporting and promoting the routine immunisation programme. Immunisation is a key intervention to give children the best start in life, and achieving high levels of immunity against vaccine-preventable diseases such as measles, mumps and rubella is vital to reducing the spread of infection and preventing outbreaks. And there's lots that education and childcare settings can do to support these programmes, such as sharing information on the routine vaccination programme with parents, and we'll signpost this within our guidance. Universities and colleges also have a role to play by sharing information on vaccines such as the MMR vaccine, such as the meningococcal ACWY, and providing information on recognising the signs and symptoms of these illnesses and providing links to general practice, healthcare, registration and services. So just to summarise the key points from the update, the future approach to managing COVID-19 in education and childcare settings will consider COVID alongside one of many other respiratory illnesses. New guidance for education and childcare settings is published on the 1st of April from UK Health Security Agency, which will provide support to education and childcare settings in the management of infectious diseases, including advice on when to seek specialist advice from your local health protection team. And education and childcare settings have a really vital role to play in the promotion of the immunisation programme to help give children the best start in life and reduce the spread of infection and prevent outbreaks. Most importantly, face-to-face education will continue to be of utmost priority for children and young people. And again, thank you for everything you have done to ensure this so far. I'm now going to hand back to Tessa, who's going to talk you through the announcement on the 29th of March, which sets out the next steps of the government's Living with COVID approach.
Thanks so much, Catherine. OK, so on the 29th of March, the Secretary of State for Health and Social Care wrote to Parliament setting out the next steps of the Living with COVID strategy, detailing how we plan to live with and manage the virus. And that, of course, built on the February publication of Living with COVID-19 strategy, which removed the remaining legal restrictions. So in his statement, the Health Secretary said that from the 1st of April, free COVID testing for the general public ends, but continues to be available for specific groups, including eligible patients and NHS staff. And he also noted that updated guidance will be published on what to do if you have symptoms of COVID or have had a positive test result. So specifically for the education sector, from the 1st of April, children and young people who are unwell and have a high temperature should stay at home and avoid contact with other people. They can go back to school, college or childcare where they no longer have a high temperature and they are well enough to attend. Adults with a positive COVID-19 test result should try and stay at home and avoid contact with other people for 5 days. For children and young people aged 18 and under, that advice to stay at home and avoid contact with other people is for 3 days. As we set out in February, regular asymptomatic testing is no longer recommended in mainstream settings. However, from the 31st of March, regular testing in SEND settings, alternative provision, open children's homes and secure children's homes is no longer advised. Residential SEND settings may still be advised by their local health protection team to reintroduce some time-limited asymptomatic testing. This would be an exceptional measure for targeted groups of staff and pupils or students of secondary age and above in the event of a possible COVID-19 outbreak. Settings will no longer be able to order test kits through the online ordering system from the 1st of April. We ask you to retain your existing test kit stock if you have some, and not distribute these without the public health advice to do so. And we will come back to you with some further advice from the UK Health Security Agency on what to do with any surplus test kits. I'm now going to hand over to Helen, who's going to talk you through a bit more detail on the specific changes to practice for settings.
Thanks, Tessa. So I'm Helen Slater and I'm one of the Deputy Directors for the COVID Response Measures team at DfE. So now that we have new UKSHA public health guidance, we've withdrawn the specific COVID guidance for education, childcare and children's social care settings, including the COVID guidance that's hosted on the Google Drive document sharing platform. Now, instead, settings should follow the advice set out by UKSHA in their guidance on managing COVID, as you would for other public health matters. And these links have been shared in the daily bulletin to the sector. We've also updated our emergency planning and response guidance for settings to reflect what we've learnt over the past 2 years in successfully managing public health and other critical situations. The DfE COVID helpline will remain in place to support the sector, and from the 1st of April will be known as the DfE Instant Support Helpline. Where necessary, the call team will help direct your public health questions to the relevant UKSHA guidance. And now that regular asymptomatic testing in mainstream education and childcare settings is no longer advised, you may have some surplus stock of self-test kits that are no longer required. UKSHA will issue further communications about managing any excess stock, but please don't hand out any test kits to staff, pupils or students unless advised by your local health protection team, local authority or Director of Public Health. Expired stock is classified as municipal waste and it may be disposed of with other waste. So in this webinar, we focused on the practicalities and transitioning to a new way of thinking about and managing COVID-19. But of course, it doesn't mean that the virus has gone away or will do anytime soon. So at the heart of moving to a new way of living with COVID is continuing those excellent habits we've developed of implementing and encouraging, of course, the basics of good hygiene, cleaning regimes and ventilation, and those safer behaviours we can all follow to reduce risks.
Great, thanks very much for that, Helen. We're now going to turn to some frequently asked questions, which we've been collating from correspondence, but also from conversations with stakeholders. So hopefully we will cover some of the key questions that you might have. The first question is, what is the scientific evidence behind the change of approach when case rates remain high at the moment? And I'm going to direct that to Catherine.
Thanks, Tessa. So I think it's obvious that the pandemic is not over yet, and how the virus will develop over time does remain uncertain. However, as we are learning to live with COVID, we are going to be focusing our testing provision on those who are at the highest risk of serious outcomes from the virus, and encouraging people to keep following simple steps to keep themselves and others safe. The population now has much stronger protection against COVID-19 than at any other point in the pandemic, thanks to the success of the vaccination programme and also access to antivirals alongside the high levels of natural immunity and increased scientific and public understanding about how to manage risk. So this means that we're now moving to manage the virus like we do other respiratory infections. The government can only take these steps because it will retain contingency capabilities, and we will respond as necessary to further resurgences or more severe variants of the virus. We will continue to review the pressure on healthcare and respond if necessary. And while testing in the general population will be reduced, surveillance will remain through the ONS Coronavirus Infection Survey and also testing in health and care settings.
Thanks very much, Catherine. We've talked a lot about the difference in advice and symptoms for children and adults. I wondered if you could say a bit about why the advice on symptoms is different for children and adults.
Thanks. I mean, I think it's worth starting by saying that we all recognise attending education is hugely important for children's health and their future. And respiratory symptoms such as coughs, sore throats, runny noses, high temperatures are common in children and young people, and especially during the winter months. And there's lots of different infections that can cause these, such as the common cold, COVID-19, and also RSV or respiratory syncytial virus. And it's not possible to tell what infection someone has by the symptoms alone. But we do know that for most children and young people, these illnesses will not be serious and they will soon recover following rest and plenty of fluids. And very few children and young people become seriously unwell with respiratory infections. This is also true for those children and young people who have long-term conditions. We do know that some children, particularly those aged under 2 and especially those born prematurely or with a heart condition, could become more seriously unwell from some of these common infections, especially RSV. But all of the advice that we are providing is trying to balance that risk of transmission with the continued harm of missed or disrupted education.
Thanks very much. And we know that many settings will be experiencing high case rates and will be concerned to know what they should do in case of an outbreak. What would be your advice to settings where they suspect an outbreak of COVID-19?
Thanks. So, I mean, most infectious diseases in education and childcare settings can be managed by following the advice that we will set out in our UKSHA Health Protection in Education and Childcare Settings guidance. And as I said earlier, we've updated this to provide up-to-date information on a range of infections. And for COVID-19, this is going to be a focus on acute respiratory infection. The most important thing that settings can do if they suspect an incident or an outbreak is to review and reinforce the baseline infection prevention and control measures that are already in place. So that might include ensuring that staff or students with symptoms do not attend the setting while they are unwell. Settings might want to seek specialist advice from their local UKHSA health protection team if they've got concerns. And, you know, in particular, we're thinking about concerns where they may have seen a higher than previously experienced or rapidly increasing number of staff or student absences, for example, due to acute respiratory infection or perhaps diarrhea and vomiting. We might want them to seek specialist advice if there's evidence of severe disease due to a respiratory infection. So, for example, if a student or staff has been admitted to hospital. And we also want settings to think about seeking specialist advice when they've got more than one infection circulating in the same group of students and staff. So, for example, chickenpox or scarlet fever.
Thanks, Catherine. We talked a bit a moment ago about a key change that is being introduced from the 1st of April is that we are no longer recommending that those in SEND and children's social care settings should test themselves regularly. I wondered if you could set out a bit more about the rationale for that change.
Yeah, absolutely. So, you know, thankfully, children and young people are at low risk of severe disease from COVID-19, and this is also true for those with chronic conditions. And whilst we do recognise that SEND settings, for example, may have a higher proportion of children and young people who have been identified as being at higher risk of serious illness from COVID-19 compared to children in mainstream settings, we do have strong underpinning and extensive evidence that the absolute risk of severe disease from COVID-19 to nearly all of these children remains much lower than for adults in general. We also know that as we individuals are now mixing in an otherwise open society, the benefit of regular testing within a setting is no longer as effective as it once was at preventing transmission. And so really the most effective protection against severe disease from COVID-19 for everybody, including those who might be at higher risk, is for them to get vaccinated.
Thanks so much, Catherine, for those responses. I now have, I think, the final question, which is going to be for Helen. So, Helen, what should a setting do if a parent sends in a child who has COVID-19 symptoms? Can a school or another setting refuse admission of a child in that scenario?
Thank you. OK, so from the 1st of April, children and young people, so that's at the age of 18, shouldn't attend their setting if they're unwell and have a high temperature, or if they've tested positive for COVID-19. Instead, the public health advice is to stay at home and avoid contact with other people. If the child is not unwell and doesn't have a high temperature, then they should be in school or a setting, and it's not advised for the setting to ask them to test for COVID-19. In most cases, parents and carers will agree that a child or pupil who is unwell and has a high temperature shouldn't attend the setting, given the potential risks to others. But if a parent or carer insists on a student or pupil attending their setting where they have a confirmed case of COVID-19 or are unwell and have a high temperature, then you can take the decision to refuse the student or pupil if, in your reasonable judgment, it is necessary to protect others from possible infection.
Thanks, Helen. Very helpful. So that brings us more or less to the close of this webinar. There's some more information available in all the guidance documents that we have spoken about, which we know you'll want to read through when you get the opportunity. If you have any further questions or do need some further support, please do use our DfE helpline or the contact form as set out on the slides. Finally, thank you so much for joining this webinar, and thank you to those who have contributed to it. And thanks also for the incredible work over the past 2 years to respond to the challenges of COVID-19. We're enormously grateful for everything that you've done and you continue to do. Thank you.